Hello and welcome to the HemWell information module regarding our company. In this session we will discuss the background of our technology, a brief description of our procedure, our competition, how our procedure is unique, expectations following our procedure, conditions that are contraindicated for our procedure, starter kit information, we will discuss coding and reimbursement information, and finally an invitation for potential providers. The technology we are going to discuss has been around a little over 10 years. Originally branded as Ultroid, Medfinity acquired it, restructured, and rebranded it as HemWell MD. Medfinity owns all the patents to this intellectual property and this FDA-approved procedure. This procedure has been performed hundreds of thousands of times successfully with no significant notable complications. The medical procedural name of our procedure is called direct current electrolytic ligation. This procedure is monopolar, meaning that the current passes safely through the body to the grounding pad and doesn't create any heat that can damage tissues. We apply between 6 to 16 milliamps, which is a very low current, to the base of the hemorrhoidal tissue. This current causes a natural chemical reaction within these damaged tissues. The water molecules begin to separate into their base atoms of oxygen and hydrogen. This creates a sodium hydroxide effect within the hemorrhoid, which chemically cauterizes the feeding vessel of the hemorrhoid, which results in a vascular thrombosis and overall tissue volume loss. Let me talk very briefly about our competition. All the competition can be boiled into a few items. They either inject, cut, burn, or compress the hemorrhoidal tissue with a variety level of success. However, all of these treatments have in common is that they treat grades 1 and 2 or grades 3 and 4. All are painful. Most of these treatments run the risk of infection, and many risk permanent incontinence due to damage to the nerves of the Dante line, and bowel prep is often involved in these procedures as well. How we are unique is the HemWell advantage over all of these other procedures is that our procedure is the least painful of all treatment options. We treat all grades of internal hemorrhoids. There is no cutting, stabbing, injecting involved. We have a very low reoccurrence rate, and additionally there is no bowel prep or risk for incontinence. The procedure can be performed without anesthesia, and most notably is that we have a 0 infection rate. Our company has been mainly marketing to providers who are performing colonoscopies because the procedure is slightly uncomfortable due to the anoscope and when higher voltages are applied. The advantage of this situation is the patient is already sedated, so the provider can use the maximum voltage on the hemorrhoid, destroying it quickly. For example, an unsedated patient can only tolerate 6 to 8 milliamps at a time for about 5 minutes. This often will result in retreatment. If the patient is sedated, the provider can use the maximum voltage at 16 milliamps, and a grade 1 can be destroyed in 4 minutes 45 seconds, a grade 2 can be destroyed in 6 minutes 12 seconds, a grade 3 can be destroyed in 8 minutes, a grade 4 can be destroyed in 9 minutes 53 seconds, with the caveat that additional treatments may be necessary with a grade 4. Keep in mind that the proverbial gold standard for grades 3 and 4 are surgical removal. There are multiple risks with surgical procedure: sepsis, bowel perforation, infections, damage to the Dante line that could result in permanent incontinence, pain for several weeks, and prolonged recovery period. Our company's goal is to be the new gold standard in treatment of hemorrhoidal disease. Our treatment does not involve any of these risks, pain, or prolonged recovery periods. Reoccurrence rates are extremely low. Following the procedure, we generally ask patients to wait 4 to 6 weeks between treatments. Many insurance companies require at least 6 weeks between treatments. Medicare and Aetna insurance require 90 days. If the patient has not had anesthesia, the patient can return to work and activities the same day. If they've had anesthesia, they can go back to work the next day. We have a very low complication rate. Most complaints are minor rectal pain, small amounts of rectal bleeding, and light serine sanguous drainage. These issues usually resolve within 48 hours. We generally treat these complications with over-the-counter Tylenol and over-the-counter Recticare topical cream. Now we will discuss individuals who are contraindicated for our procedure. Patients who are pregnant, patients who have a pacemaker or defibrillator implant, with the caveat that we recommend that the patient goes and gets a note from their cardiologist before proceeding. Patients who have any kind of bleeding disorders, Patients who are on anticoagulant therapy such as warfarin sodium, again with a caveat that we recommend that the patient goes and gets a note from their cardiologist before proceeding and gets on a bridging program prior to the procedure. Any patients with an active anorectal infection, patients with any kind of inflammatory bowel disease, patients that have a lower abdominal, lower quadrant transplant patients, such as hip replacements, we recommend that the patient get a note from their family physician before proceeding, or any patients with Crohn's disease. Once a facility has signed a contract with our company, they will receive a starter kit. The starter kit includes the base unit, one controller handle, one grounding wire, 100 yellow sponge grounding pads, 12 non-sterilized probe catheters, which must be autoclaved before use, and 100 disposable anescopes. Important to note that D-cell batteries are not included, and the facility will need to have an autoclave to sterilize the probe catheters. If this is an issue, please let HemWell MD know. We may be able to assist you with acquiring one. Now we will discuss briefly coding and reimbursement. The most ideal treatment modality is when we combine the HemWell procedure with a colonoscopy. When these two procedures are combined using the internal hemorrhoid procedure, single hemorrhoid CPT code 46945, and a colonoscopy procedure CPT code 45378 in an ambulatory surgical center, the facility fee for both procedures would be $1,353.91, and the physician fee would be $452.02. Reimbursement's even greater in a hospital setting for the facility fee. The facility fee for both procedures would be $2,846.29, and the physician's fee would be $452.02. When providing multiple procedures, when combining the two procedures using the internal hemorrhoid procedure 2 or more, CPT code 46946, and colonoscopy procedure CPT code 45378 in an ambulatory surgical center, the facility fee for both procedures would be $1,353.91, and the physician fee would be $496.41. Reimbursement is even greater in a hospital setting for the facility fee. The facility fee for both procedures would be $2,846.29, and the physician's fee would be $496.41. At HemWell MD, we do not sell our equipment. We charge a flat fee of $250 per patient for the use of our machine. In conclusion, if you're interested in becoming a HemWell provider, please fill out the information card under the Physicians Administrators tab at the top of the HemWell MD website, or email us at info@hemwellmd.com. This concludes the HemWell information module regarding our company. Thank you for your attention.